Hello, everybody, and welcome back to the Medical Minutes. Today's topic is IT Band Impingement Syndrome, not IT Band Friction Syndrome. That's an old school term. We're going to find out why the verbiage has changed and what we can do to correct it. All right, stay tuned. All right, so getting right into it, why is it not IT band friction syndrome anymore? We used to believe that the IT band, the structure on the outside of the thigh, was loosely attached closer to the knee, and when the knee would flex and extend, it would rub over the outside of the femur or the thigh bone. That rubbing led to friction. Friction led to heat and irritation, inflammation, and pain. Okay. Secondary to that, there was a belief that there was a subcutaneous bursa sac, or a bursa, a fluid-filled sac underneath that structure. So when it was rubbing over the outside of the thigh bone, it was also rubbing over that bursa. That bursa could get inflamed and irritated, hot, redness, heat, irritation, inflammation, pain. Okay, so that was the common belief for a number of years. I was taught that, and ever since so, with a little bit better dissection techniques and people just kind of questioning why, they've dug a little bit deeper and found that the distal end, or the lower end of that IT band, is actually firmly attached to the bone, meaning it's an optical illusion almost, where it doesn't actually rub or move over that outside of the lateral femoral condyle. As well as they dissected, they found there was really no subcutaneous bursa there. But what they did find is a highly vascularized and innervated fat pad. Okay, so we've got fat pads all over our body, and they're usually designed similar to a bursa to absorb force and reduce points of friction. The body's great at putting them in these locations, but this highly innervated and vascularized fat pad makes sense as to why there would be pain, in that area. So what we're seeing is that it's more of the compression of that structure on that fat pad that leads to the pain, hence more of an impingement syndrome rather than a bursitis or a friction syndrome.
But wait, there's more.
All right, well, that's what I get for making videos in a school with the classroom bell. All right, so then a couple ways we can treat this, right? I want to keep this video kind of short. The first one is with, we'll say, over-the-counter pharmaceuticals, your ibuprofen, Motrins, Aleve, NSAIDs, non-steroidal anti-inflammatory medications. What works really well is if your pain or discomfort has only been going on for 3 weeks or less, 21 days or less, these work pretty good. You could do a course of these, try and regiment it, 3 times a day, roughly 400, 600 milligrams per time. And take with some food, okay? They can work pretty good. Now, the issue with this is usually in athletes anyway, IT band impingement syndrome usually goes on for weeks or months before they seek a healthcare professional. So if the pain has been less than 14 days or 2 weeks, we've actually seen pretty good results with corticosteroid injections, all right? So if you have the ability to get in with a physician and you get a cortisone shot, if the pain has been 14 days or less, there's pretty good results with that. The one thing we know for sure that we should not be doing as clinicians anymore are the deep tissue friction massages, the old school where you get your thumb on it, you kind of just rub cross friction on that IT band right where your pain is. They were excruciatingly painful. They had like a coin flip results in terms of some people will get better from, some wouldn't. And we realize now that what we're doing is we're just irritating it even more. So whereas some didn't get any better, the ones that got worse, there's really no surprise anymore. All right, so now the real reason why you're all here, how do you get better? Okay, you're an athlete that's in pain, you want to feel less pain. What the research is showing is that hip strengthening is your best bet, okay? So it's your hip rotators, your hip extensors, and your hip abductors, all right? So anything that goes away from the body. So from the quadruped position, these are your fire hydrants, these are your donkey kicks. From the side lie position, clamshell exercises, side lie, heel to the sky type raises, or straight leg raises on your side. With all of these, I like to start with 2x12. All right, both sides. All right, even if your pain is only one side, all of these we do bilaterally, or both sides. 2x12, go through the whole set of list, or the whole list of exercises. And then when you feel like that's not challenging enough, 3x12. Okay, go through the whole list a couple times. Once that's not challenging, 4x12, and most people kind of live in that range, 4x15, 4x10, 4x12 in terms of a maintenance program. Now, the one exercise that I didn't mention yet that is proven to be one of the better or best exercises to do would be lateral band walks. Okay, so if you have a circle band, you can start off with a light resistance. That's fine. A lot of people will do these with the band at their knee level or at their ankle level. The research shows that if you put the band around your feet, okay, so almost at your toes, okay, and still do your lateral band walks, to the right 10 steps, to the left 10 steps, etc. You can mess with the reps and sets. What that does is that actually helps control the tibial rotation as well as strengthen the hip rotator. So a lot of good success with that. Again, you have to trust the process. It's going to take, maybe a few weeks of rehab. If you can work them in 3 to 4 times a week. But realize that the hip strengthening, along with the pharmaceuticals and the heating, and some of the other stuff, should be your best bet in terms of relieving IT Band Impingement Syndrome pain. Okay, so hopefully you guys got a lot out of this video. Please like and subscribe if you haven't already. The channel is definitely growing, and I'm getting more and more topic requests. So this is going to be some good stuff. That's pretty much it. That's all I got. So thank you for tuning in, and I'll see you guys in the next one.